Hello everyone, I'm very happy to meet you again as I promised in the end of my previous short video. Um, we will be talking a little bit more about demography. So let me just remind you that demography is a study of populations, especially with the reference of size, density, fertility, mortality, growth, age, distribution, migration, vital statistics, and the integration of all of these with social and economic conditions. So that therefore involves income and education and marital status and so on and so forth. Demography by itself is a science. Well, nothing wrong about it. It's a huge science. It's very interesting. Lots of people work on different aspects of demography, either in terms of research or daily practice. But for the purposes of my own, we'll be looking at demography as a planning tool. Remember, in the beginning, I spoke about decision making in health sector, how we make decisions. Normally, decisions should be based on a solid and robust evidence, statistical evidence, whether it refers to the demographic aspects of the population or morbidity, what we refer as epidemiology. Therefore, demography is a very convenient tool to understand the needs, including the health needs of your population. Well, let me give you an example. In the United States, for instance, whenever you apply for driver's license or social security number, or you want to take a overseas passport to travel abroad, you submit an application form. And in that application form, beyond your full name and date of birth and the place of birth, you also are asked to provide information on your average income, like they provide there the income groups from whatever number to whatever number, and it's completely voluntary, or your racial belonging, or your ethnic belonging, or the language spoken, and of course there is your age and the gender, and also you indicate your marital status, and there are a couple of options like the married, divorced, separated, and so on and so forth. And most of this data, besides the very basic ones, is absolutely voluntary. You're free not to disclose it. Why then the governments are interested in knowing all of that? Not because of the purposes of discrimination, at least that's how it is in the United States, but for the purposes of planning. Imagine, we certainly want to know what is the gender balance. Well, is it 50-50, or it's in favor of men or in favor of women? And that makes a huge difference. I know the countries, especially very poor countries in Southeast Asia or in Central Africa, where there are more men than women. Well, the key there is the poverty. At birth, the girls and boys are born at equal proportion, but families with multiple children rather welcome boys than girls. And there are places where the newborn girls are just simply killed because boys are more instrumental in doing farming or whatever other work. I know a country which is right in the middle of Europe, where there are more women than men, and that is country of Moldova, where I used to work almost exactly 3 years as a diplomat. And in that country, after the Soviet Union collapsed and the country appeared to be independent, since the economic profile was very low, lots of young men migrated to neighboring Romania, and then at the time being to the rest of Europe as migrant workers. So even now there is a disbalance. There are more women in this country than men, and it makes lots of sense to know that. Why? Because simply speaking about the genders, like men and women have quite different health needs. For instance, if there are more women in your country, especially women of reproductive age, you have to have more maternity beds in your hospitals, more specialists of, say, reproductive health in your primary care sector, and so on and so forth. So therefore, all this data is very important. Now, let me show you this graph, which is well known to all in our community, and we call it population pyramid. And that's about the United States, and it equally actually extends to the rest of the Eastern European countries. Western European countries and the Eastern European countries nowadays. The first one is a population structure of the United States in the year 1900. And the other one shows the population structure in 89 years' time, in 1989. Well, let's concentrate on the first one. So each bar represents a share of a certain age group within the total population in the form of percentage. So you will see there from 0 to 4, like from birth to 4 years, from 5 to 9, 10 to 14, and so on and so forth. And as you can see, the size of these bars gradually decreases while moving towards the top. And it has a almost perfect triangular shape, so that's why we call it population pyramid. Now, the other one looks like a Coca-Cola bottle or bell. What is the main difference? The younger age groups have shrank, while the people of middle age and elderly widened their proportion. So something special happened, I believe, within that 89 years, so that in the United States and in many developing nations, this pyramid has changed its triangular shape into the bell shape or bottle shape. And there have been three, besides the major improvement of quality of life and the economic development, which actually translates for people into better education, better living conditions, better food, better nutrition. Therefore, there have been three main, I would say, milestones happening in the area of health medicine. And the first one is vaccination. The more and more vaccines have been made against quite tough infectious diseases exactly within that period of time, and these vaccines made available to the wider, circles of population. So therefore, these vaccines and the vaccination campaigns allowed to reduce the mortality. This second, that is related with X-ray machine. So before Professor Röntgen in Germany by chance discovered X-rays, we couldn't see physically what's inside of the body of our patient. We could only guess by palpating, performing percussion or auscultating. And the X-ray allowed us, X-ray machine, to see what's inside. And that represented a major breakthrough in more precision diagnostic procedures, and therefore better and timely treatment. And the third one is obviously related with antibiotics, when Dr. Fleming in 1939 in England made the first dose of penicillin. And then very soon, within the next couple of years, it became available worldwide. And penicillin and antibiotics allowed to save hundreds and millions of lives. So therefore, what happened in these 89 years in the United States, people started living longer, better lives. Now, the issue is that in many the countries, in many poor countries, the population structure still looks like the pyramid. Why? Because people do not live up to the certain age. They die earlier because of widespread infectious diseases. Okay, so now the question is, which one population is more cheaper to treat, to manage their health conditions? Which one health system is cheaper to run? The one where the population has a triangular shape in terms of its structure, or the bell shape? And the answer to this question is quite straightforward. It's a bell shape. Why? Because we, the human beings, uh, consume most of the healthcare when we turn 40 and beyond. And as you can see on this pyramid, on the second, not pyramid, but this bell-shaped structure, bell-shaped graph on the second one, you will see that more and more people are concentrated in that particular area from 40 up to uh, 85 and so. Um, Now, what we are also interested in knowing uh, in terms of its planning value and demography is the fertility rates. How many new kids are born? And there are two main types of fertility rates, crude birth rate and the total fertility rate. What is crude birth rate? It's a number of live births during a year divided by the mid-year average mid-year population and multiplied, say, by 1,000. And it tells you how many kids are born per 1,000 of your population. But and there is one big issue with that, that many politicians, even economists, for the planning purposes use the crude birth rate, and it's a huge mistake. We have another one more convenient, more informative, which is total fertility rate. It is the average number of children that would be born per woman if all women live to the end of their childbearing years and bore children according to age-specific fertility rates in that population. In other words, simply speaking, it is about how many kids on average a woman of reproductive age is having in that particular country in that particular year. Okay? So that's very important. And total fertility rate, or TFR, has one magic number. It's 2.1. You cannot really have 2.1 children. You have either 2 or 3. But from the statistical point of view, you can have 2.1. So the 2.1 is a replacement level. So if your total fertility rate in your country in a given year is 2.1, and the other variables like migration, death rates are held constant, your population in terms of its size will stay the same. But if your total fertility rate is less than 2.1, then your population will decrease in numbers, it will shrink. If it is over 2.1, that the population size will increase. So that's very important to know, because the crude birth rates, that doesn't give the politicians and policymakers a clear idea what to do. While with the total fertility rate, you certainly know. I mean, if it is, say, well over 2.1, like 4 or 5 or 6, so most certainly your country is running into trouble because there might be the deficit of resources to feed these new children, to provide good health care. So that's what the countries like India and China have been facing for a long time. So probably today we do not have time for that, but probably in one of my next videos I will talk more about it. Well, there is the other extent which my country, Georgia, experiences. Well, our total fertility rate within the last 100 years has never been above 2.1. It was always below 2.1, and we have another problem. Well, our population is shrinking, and this country is already really small, and with its shrinking population, we developed the economic problems, and it's in general a kind of a national problem that the people of Georgia, there are less and less people live in Georgia. So I'm going to stop here, and I will provide the next video as a continuation of this talk about demography. Thank you, and I will see you very soon.